Hi everyone, my name is Anthony Kohn and I will talk about to emphysematous cystitis. Definition: emphysematous cystitis is a rare entity characterized by pockets of gas in and around the bladder wall produced by bacterial or fungal fermentation. The presentation may be atypical and contrary to degree of inflammation. Patients may present with subclinical findings. Patients may complain of irritative symptoms, abdominal discomfort, or pneumaturia.
Cystitis, also known as the inferior urinary tract infection, is the inflammation of the bladder. Cystitis is more common in women because women's urethra is shorter than men's urethra and it is closer to the anus. The urethra is the last tubular structure of the urinary tract that conducts the urine from the bladder to the outside of the body. Women's urethra is about 4 centimeters long. Men's urethra is about 15 to 25 centimeters long. The most common cause of acute cystitis is bacterial infection, in many cases caused by a bacterium called Escherichia coli. Normally, the urinary tract is sterile. Sometimes bacteria from the skin can get into the urethra and migrate back up the urinary tract, causing urinary tract infections. The most important contributing factors are constipation, sex, low fluid intake, cold. Clinical symptoms include pollakiuria, which is an abnormally frequent urination, dysuria, which is pain or a burning sensation during urination, pain in the inferior abdominal region, cloudy urine, hematuria, meaning blood in urine, but this symptom is rare in cystitis. Fever is not a common symptom for cystitis. Your doctor might indicate a urine culture, which is a test that identifies the bacteria that cause cystitis. It is very important not to take any antibiotics before the urine culture, as this may lead to false negative results. This is how you should collect a urine sample. First, wash your hands and then your genitalia. Then collect some midstream urine, approximately half full of the sterile container that you will receive, and take it to the laboratory analysis. The urine culture is usually associated with susceptibility testing to see which antibiotics will inhibit the development of the bacteria causing the infection. The result of urine culture is normally ready in 2 to 3 days. Because in these 2 or 3 days it is not known for sure which are the bacteria that cause the infection nor the right antibiotic, the doctor will indicate empirical treatment. Empirical treatment is the treatment prescribed before the definitive diagnosis is established based on doctor's medical observation and experience. After the result is ready, the doctor will indicate the most appropriate antibiotic for the infection. In some cases, the infection may progress with spontaneous healing. Most of urinary tract infections can be easily treated if they are addressed in time. If not addressed in time, complications may occur, such as the spread of the infection to the kidneys. This is why early diagnosis and treatment are so important.
Application in medicine. A 72-year-old woman with poorly controlled hyperlipidemia and diabetes presents to the emergency department with a 5-day history of lower abdominal pain. She also had fever and reported nausea and vomiting. Physical examination revealed leukocytosis associated with a left shift and elevation of the levels of C-reactive protein and glucose. Unplayed radiograph in the kidneys, ureters, and the bladder showed air surrounding the bladder. An abdominal computed tomography scan revealed an area of gas designating the bladder wall. bilateral hydronephrosis, and intramural gas with a globestone of breath necklace appearance. Finding consists with emphysematous cystitis. Pros and cons. Pros. The radiographic findings provide the first and only diagnostic clue. Abdominopelvic tomography computerized scan can thoroughly delineate the extent of the size. Cons. Emphysematous cystitis requires aggressive treatment with parenteral antibiotics and bladder drainage. Delayed diagnosis may lead to unfavorable outcomes including overwhelming infection, extending to ureters and the renal parenchyma. Insults applied in Ecuador. Emphysematous cystitis is a urinary tract infection that is associated with the gas formation and is commonly caused by E. coli and Klebsiella pneumoniae. The disease is often associated with female sex, immunocompromised state, diabetes mellitus, previous recurrent urinary tract infections, urinary stasis, urinary bladder, and transplant recipient.
Hi, welcome back everyone. Today I am going to discuss an interesting topic of emphysematous pyelonephritis, the radiological classification as well as Hyong-Seng classification with a classic example. So let us see. A 80-year-old female diabetic patient presented with fever and right loin pain, and this is the topogram of CT abdomen. The main findings which we observe here are the motile lucencies in the right renal region. You can see the air lucencies in the shape of renal parenchyma, that is the renal shadow, and you can see the left renal shadow is normal, no significant abnormality in the left renal region. And you can see the few linear air lucencies in the right suprarenal region extending up to the hepatic region. And the bowel gas is non-specific, and visualized bones were mildly osteopenic without any abnormal bone lesions. Coming to plain CT-KUB, in view of raised creatinine, contrast study could not be performed, and the plain CT revealed enlarged right kidney with mild perinephric fat standing and multiple air pockets within the renal parenchyma as well as in the pelvic ileal system. And in coronal reformated image, you can see linear lucencies which are extending beyond the pararenal space, extending up to the hepatic region, in the perihepatic region. Left kidney is completely normal with normal perinephric fascia. No obvious fluid collections were seen. around the renal parenchyma. Coming to the classification of emphysematous pyelonephritis, it's radiological as well as Yongsen classification. Radiologically, we classify it into type 1 and type 2. Type 1 is no fluid collections and it indicates a poor prognosis because more than one third of renal parenchyma is involved. In type 2, it is a good prognosis and few fluid collections might be present and less than one third of renal parenchyma is involved. Coming to Yongsen classification, which is of a prognostic classification in emphysematous pyelonephritis, it's classified into 1, 2, 3A, 3B, and class 4. Class 1 to 4, as it goes down, the mortality increases. Class 1 and 2 come under localized type of emphysematous pyelonephritis, and class 3 and 4 include under extensive type of emphysematous pyelonephritis.
Conclusion. In conclusion, the patients we treated was with a broad spectrum antimicrobial agents and placement of a folic character. Subsequently, a urine culture was positive for E. coli. The patient was treated with antibiotics and recovered univert fully.
Hello, I am Martina Fumeo and I'd love to give you a brief description of our article Emphysematous cystitis, a review of current literature, diagnosis and management challenges. The aim of this review is to give you an inclusive and general description of this pathology in dogs with an eye to human medicine. Emphysematous cystitis, EC, is a rare disease in human as well as in veterinary medicine. In both, it is defined as an uncommon form of complicated urinary tract infection, UTI, characterized by the presence of gas within the bladder wall in the human. It must be differentiated from the term pneumaturia, which is described as the passage of gas or air in the urine. Despite its first description in human medicine in 1671, little is known about this disease worldwide. Clinical presentation of EC is variable, and patients with EC are not subject to gender or age predisposition. Diabetes mellitus appears as the most common risk factors for the development of EC, but many other underlying conditions have been mentioned in literature and should be taken into consideration. In case of EC, Escherichia coli appears to be the most common pathogen isolated from urine cultures. Urine culture and antibiogram should be performed in order to set up an appropriate antibiotic therapy, which could reduce the need of surgery, together with an early diagnosis. The prevalence of EC could be underestimated as diagnostic imaging is necessary for the detection of this condition and for a conclusive diagnosis. It has been suggested that ultrasonography may be a more sensitive technique for detection of gas within the bladder at an early stage. Since there are no significant clinical features strongly suggestive of EC, it could be assumed that every patient presenting UTI signs, even mildly, and with a history of diabetes and other risk factors, should be evaluated radiographically and or ultrasonographically to detect or exclude the presence of EC. Nonetheless, further studies are still necessary to better define this pathology and the real prevalence of these conditions. Thank you for your attention.
Thank you.